right, welcome everybody. Thank you for taking time today to join us. I appreciate you spending time here today to discuss some critical topics during our healthcare roundtable discussion. My name is Mark Sherry. I'm the Regional Director of Human Resources here at Baylor Scott & White Healthcare. And I'd like to introduce Valerie.
Welcome. Yeah, thanks, Mark. Welcome, everybody. My name is Valerie Esparza. I'm the Director of Strategic Operations, Workforce Development, Diversity, and Inclusion at Ascension Seton. And we're going to be hosting this call for the next hour.
Thank you, Valerie. Our intent today of this call is to hear from our healthcare facilities, our partners here in the Austin area, regarding current challenges that they're facing, the types of support they may need in their workforce as we posture through this uncertain time. As such, we'll be asking that if you participate in this call, but do not represent a healthcare industry, if you please would remain on mute and do not share your video during this time frame.
Yeah, we definitely like each of the healthcare organizations or representatives to please introduce yourselves by stating your name and your organization's name. And we'd also would appreciate it if you could share in 1 or 2 sentences how COVID has affected your workflow or your organization. As a reminder, please remember to mute yourself when you're not speaking so that way we can avoid background noise. So I would go ahead and begin introductions. I don't know who's all on the call.
Do we have any healthcare organizations that are on the call right now, able to join?
This is Sarah Willingham. I'm the senior recruiter with Community Care Health Centers here in Austin. And on the recruitment side, we've actually been probably hiring more positions, especially on the temp side for COVID-19 testing than we have before. So it's been busy.
Thank you, Sarah, for joining us. I appreciate that. Do we have anybody else from healthcare that would like to introduce themselves?
Good morning.
Right, well,
this is
as more people may be joining, go ahead, Angela.
Thank you, Mark. This is Angela. I represent Central Health, and just like Sarah is one of our partner at Community Care. We have been quite busy, and COVID has only given us more reason to hire people because it has brought forward a need for a lot of clinicians, as you may understand, and a lot of IT personnel that is needed during this times where a lot of us are working remotely.
Angela, thank you for sharing. Appreciate that. As we started, and more people may be joining as we move through the hour during this call, we're going to transition right now to introduce Leslie Puckett of Workforce Solutions, and Leslie's going to take some time to share with us some industry-specific labor market information during this time. Leslie?
Great. Thank you so much, Mark. I appreciate it. Yes, I will be sharing my screen with you in a moment. 1 second, please. And I have a quick presentation on the labor market, and my colleague Jessica Garay will also be speaking. So please bear with me. Great. So I'm Leslie Puckett. I'm the Director of Research and Career Awareness with Workforce Solutions Capital Area. Jessica and I will be going through some information about how our local healthcare providers have reported being impacted by COVID-19. The state of the job market based on an analysis of weekly job postings pre and post-COVID. And I'll also share some information with you about local talent with healthcare experience that's available to go to work for you right now. So the first slide, about a month ago, we started collecting some survey information from our region's employers to learn about how the COVID-19 crisis has affected their businesses. We had 15 healthcare companies respond to the survey. Of those employers that responded, 6 of them reported that they had temporarily furloughed or laid off their workers. However, 2 did report that they are hiring due to increased business. An overwhelming majority of the respondents, 87%, reported that they are open for business. Many of those companies reported that they are implementing stringent health and safety rules in the workplace, including temporary work areas outside, working from home if it's possible for employees, social distancing, sanitizing work areas, and having sanitizing stations available on the work site, PPE including masks, wellness checks including temperature checks, and also added security. All of the employers that responded to the survey unfortunately reported revenue loss. Of those that gave us specifics, over half of them reported serious revenue loss. 3 of the 15 said they've experienced 25 to 50% revenue loss, while 4 said they've experienced 50 to 75% revenue loss. Despite all these changes and the uncertainty around this time, employers do seem optimistic about the future. Over half said they don't anticipate a future reduction in their workforce, and almost half expect to increase headcount in the future. And as you can see here, a few of them gave us information about where they're located. And so some are in Round Rock, North Austin area, and then a few are in the South Austin, and then even in the Lockhart area. So the next slide goes over some information that Workforce Solutions exclusively receives from the Texas Workforce Commission. And it's data about the unemployment insurance claimants in our region, in Travis County. We consider these individuals your future workforce. And we have, and so this slide is an overview of the claimants with past experience working in the healthcare sector. So since the beginning of March, we've had about almost 7,500 claimants with experience in the healthcare sector file for unemployment insurance. That's about 8% of the total claimants in our region over the past 2 months. As you can see in the chart on the right, that the majority of them have a high school diploma or GED, and then also some of them have some college but no degree. The majority of these live in the North Austin, Pflugerville area, as you can see on the map on the left, and then there's a cluster of zip codes in the Sunset Valley area where the claimants live as well. So my colleague Amber Warren will be talking later on in this webinar about Workforce Solutions services that we can use to connect you with these individuals. So please let us know if you have any other questions. And then the next slide, I analyzed job posting trends pre and post COVID. I started looking at early March 2020. There was an average of about 760 healthcare job postings per week, which was about 15% of total postings. As you can see from the chart on the right, the job postings have fluctuated over the weeks, and ending in last week. We've had a few spikes in job postings as well as significant drops in job postings. But on average, the healthcare job postings have represented about 17% of all total job postings. I would like to note that some of these job postings may be duplicates, since some companies do post their jobs on multiple sites in addition to their websites like LinkedIn and Indeed, but this is our best estimate. So as I mentioned, we had some job postings that spiked during the weeks of March 2020 22nd and April 5th. I haven't been able to ascertain the specific reason behind this spike, but perhaps it could be that healthcare companies were ramping up their workforce in response to COVID. And then in regard to the dip to 13% of the job postings during April 19th, healthcare employers may have been readjusting their needs. And I know that some elective surgeries have been canceled or delayed and dental offices have been closed. But this might be a good conversation for the group to discuss. As of last week, the healthcare job postings accounted for about 16% of all total postings. Now I'll turn it over to my colleague, Jessica Garay. She'll be speaking about labor market trends within 4 specific areas of the healthcare industry.
Thank you, Leslie, for the overview and the introduction. As Leslie mentioned, I'm Jessica Garay, the Data and Career Awareness Project Coordinator with Workforce Solutions. In the next 4 slides, I'm going to share with you an analysis we conducted of real-time labor market data across 4 healthcare sectors in the Austin Round Rock MSA. The sectors we analyzed were clinics, home healthcare, hospitals, and older adult services for Q1 of 2020, which was January through March of this year. The value of analyzing real-time labor market data allows Workforce Solutions to identify local labor needs, such as increased hiring or possible furloughs. We're able to identify labor market gaps and demand for skills and industry-specific credentials specific to the Austin Round Rock area. I'm also going to be sending you a 1-pager of the deep analysis that I'm going to review in these slides, so no need to quickly take notes. So we can go ahead to the next slide. So in this slide, we have listed the top 5 occupations and the average annual salary for positions in clinics that appeared in real-time job ads for Q1 2020. These occupations were health technologists and technicians, medical secretaries, medical assistants, physical therapists, and registered nurses. For the sake of time, I won't list out every occupation in the next 3 slides, but I do want to share that I've emboldened the occupations that show up across the other sectors within healthcare. For instance, registered nurses are in demand for clinics, home care, hospitals, and older adult services. But I bet that comes to no surprise to everyone. Registered nurses have historically been in the highest demand for healthcare in our region for some time now. We also analyzed the top specialized skills that appeared in these real-time job postings. And for this slide, it was scheduling, customer service, patient care, customer billing, and medical coding. And again, I've emboldened the specialized skills that will appear in other areas. And we can go to the next slide. For home healthcare, the top 5 occupations listed were the following. And again, I've highlighted registered nurses, personal care aides, LVNs, and nursing assistants. And again, patient care is another top specialized skill. Again, you'll notice there's a great demand for the emboldened occupations. I want you to also take note of the variety of occupations listed here based on education level required. It's interesting that the entry-level positions and middle to higher skill jobs are within home health care. I think this is an excellent opportunity to upskill entry-level workers into these middle skill jobs, so we can upskill and backfill for those easier entry points for our entry-level workers. All right, we can go to the next slide. So for hospitals, again, the top occupations are listed. And again, you're going to see registered nurses appear again. We have nursing assistants, and some of the specialized skills are listed below. And then we have patient care and scheduling as some top specialized skills. Again, here is an opportunity to upskill nursing assistants to become registered nurses within the hospitals. And then lastly, on the next slide, we analyzed older adult services positions. And for those top 5 occupations, we also had a variety of skill sets and educational requirements for these entry to middle skill occupations: personal care aides, registered nurses, nursing assistants, and LVN. So there's definitely a variety there. And then again, you're going to see these top specialized skills, and again, scheduling pops up again here. So to summarize these occupations listed, I think it's important to note that between January and March of this year, these postings were in demand for our region. With or without COVID-19, there was already a labor gap for some of these occupations. So for instance, we conducted another analysis, and it appears to show that in the next 5 years, it was indicated that there would be a labor gap for health technologists and technicians, LVNs, nursing assistants, physical therapists, and registered nurses in Austin Round Rock. As I said before, I believe this gives us a unique opportunity for employers, training providers, and the workforce board to come together and address these labor gaps with upskilling programs to upskill and to backfill. Please talk to our upskilling director, Amber Warren, if you have any questions on what this looks like. We have a wonderful upskilling toolkit, by the way, that we can share with you as well. Thank you so much.
Great, thanks so much, Jessica. And thank you, everybody. Just to sum up and follow up on what Jessica said, the healthcare industry has experienced furloughs and layoffs, but a majority of our survey respondents reported being open for business and that they were adapting to the increased health and safety regulations in order to keep workers and patients healthy and keep their operations going. And many respondents were optimistic about future revenue and did not expect to reduce their workforce in the future. And then, as Jessica said, if you have any questions about how to upskill your current workforce and backfill, you can reach out to Amber Warren. So thank you so much, and I will turn it back over to Valerie and Mark and stop sharing my screen.
Thanks, Leslie. Very interesting information. And, you know, this is, we'd like to definitely open up a discussion among our healthcare representatives on the call. I know that we've introduced ourselves, but I encourage everybody to speak up or to answer these questions. And one of the things that we'd like to discuss is, what roles are you hiring for now? And I know that in your introduction, Sarah, you kind of talked a little bit about, your recruiting. Just be really interested to know who is hiring now and what positions are there.
Specifically, we have a lot of medical assistant vacancies. I just got word that we're ramping up hiring for some of our dental positions as well. But on my end, particularly medical assistants and medical administrative clerks on the scheduling side. We have permanent positions for MAs and MACs, as well as temporary positions that are specific to our COVID-19 testing teams.
So it seems pretty consistent with the information we just had on the presentation. Is that correct?
Absolutely. And my colleague Angela actually does our nursing recruitment, and I think that she'll confirm we were hiring nurses before COVID-19, but we're really ramping that up as well post COVID-19. So Angela, do you want to weigh in on that?
Yes, absolutely. That is true. On our side, luckily, some other organizations have been hit harder. We haven't lessened the hiring push. It has continued, and now we are gearing up to, as Sarah stated, really bring forth some COVID testing teams to assist us in this endeavor. Thanks.
Yeah, thank you. It seems like there's always a nursing shortage, so it's not surprising that, that's a consistent position that's always going to be hired for. Any other healthcare representatives on this presentation that would like to talk about the roles that you're hiring for now?
Sure. This is Rose Sines, and I represent the Texas Assisted Living Association, where we have, well, the state of Texas has over 2,000 assisted living communities across the state, and particularly in this area, in the capital area here in Austin, we have a significant number of communities. And our members are consistently hiring for direct caregivers. And direct caregivers really can have a variety of different experiences. They can have very little, limited direct experience and be trained and educated and grow and have a lot of career opportunities for growth. Or they can have a significant amount of experience and have even a certification as a nursing assistant, medication assistant, and more. I guess the key thing is they do not have to be certified to be able to join the organizations in assisted living. They can be trained. And we've had a lot of great success stories with individuals, including myself, who have grown within the industry. So I'm also a nurse. And so I do represent our nurses as well across, and nursing shortage has been an ongoing thing. Assisted living does hire nurses. We hire both registered nurses and licensed vocational nurses. And we specifically need a lot of specialties in our nursing for geriatric care. And there's not a lot of specialists in geriatrics. Advanced practice nurses typically come into communities and work, but we're mostly interested in the communities for a registered nurse to oversee in more of a leadership role and do trainings, coachings, even are in delegation. And licensed vocational nurses typically are on the job, on site, working and supervising. So we're constantly hiring for those key positions. Another area that's a little different is in the kitchen. We have a huge culinary department in our communities. We have 3 meals a day that are provided for residents and lots of varieties on meals. It's very much restaurant quality and a lot of variety on the menu options. So we need chefs, culinary degreed chefs. We also need cooks, line cooks, and individuals that can grow into director roles. We need servers. And we also need a lot of hospitality services. So it's a very rounded group. It's kind of a cross between the hospitality industry and the healthcare industry. And so there's a lot of different position options that come up. Texas Assisted Living Association does have on their website a description of all the different roles that may help candidates that are looking.
Yeah, definitely. Thank you for sharing that. I think that it makes sense that you would be hiring for all these hospitality roles still. Are you, I imagine with other, well, over the past, months with hot restaurants and bars closing down, have you guys had a lot of good candidates from that pool? Or do you know?
Yes, I do know. And yes, we have had a significant increase in interest from the hospitality sector that has come in, which we welcome with open arms, because many times these individuals would have never even looked or thought to work in an older adult population. And so when they come in and then they see the tremendous rewards that come as a result of working for senior adults, it's pretty amazing. So we're very grateful for that and to support them and their families, of course.
Good. Thank you, Rose. Anyone else on the call that would like to share? And so I think the next question is pretty similar. And I think that, we talked about it a little bit, but, what hiring needs do you anticipate post-COVID? And I think we have to say post-COVID because it's not like things are going to return back to normal. So it's a new workplace normal. So what hiring needs do you guys anticipate? I know that we talked about we'll still need nurses, but Sarah or Angela, any other positions you can anticipate?
I don't think the positions that we're recruiting for will change necessarily. But just the number of open positions, I think will really increase in the coming months. That's just my assumption, but I think some of our hiring managers that were perhaps holding off on interviewing candidates just to see how everything went over the next few weeks and months are really going to be making hiring decisions very quickly, and I think our number of vacancies will increase. I don't anticipate new positions necessarily, although these COVID-19 testing teams, though they are MA positions, are really configured very differently than an MA at one of our clinic locations. Outdoor testing, traveling between locations, doing a lot of patient navigation over the phone. So while the title may not change, I think perhaps the job responsibilities may be different post-COVID.
Yeah, definitely. I think that, go ahead, Angela.
Yes, I was just going to mention that on the Central Health side, we have initiated and we've placed about 12 positions out there. We want to begin a new call center to begin taking calls from those that are affected and those that have questions about how to move forward in the age of COVID with healthcare appointments, with questions about getting services, etc.
Yeah, I definitely know, like for, you know, for us, telemedicine and, you know, virtual appointments have really spiked over the past couple of months. And so it seems like that's a new way of doing business as well, and the higher needs that we'll have in regards to that. How about you, Rose? What do you anticipate having these same hiring needs post-COVID?
Yes, we were experiencing this hiring need prior to COVID. And actually, it's even more significant now because of the susceptibility of individuals contracting COVID. They then have to be removed from the community for a minimum of the 14-day quarantine period. So we actually have to staff up currently in order to be able to handle any potential risk of somebody being exposed and having to leave. And then post-COVID, we anticipate that it's going to continue. The need and the demand. The other significant thing is we are still experiencing development and growth in the industry. And we have several communities that are going to be coming online. And they have decided, the state has decided they will continue to do licensing of new facilities at this time. So we're still going to experience, especially in this Capital Metro area, a demand for employees to join our teams.
Definitely. I know that, you know, that one of the statistics are that there are 10,000 people in the baby boomer generation reaching retirement age every day. So I can imagine that, you know, the needs for assisted living and, you know, elderly care is just increasing. So I imagine that there's always going to be a need or roles that you're hiring for.
Absolutely, and we're seeing that across the industry, across the country. We've been planning for what we call the silver tsunami in our industry for many years now. We still project out about an additional 10 years before we really see it, since the average age in a community is about 85 years old, which is surprising. But we're all living longer and healthier, which is really beneficial. So we anticipate this growth to continue for a good amount of time, and we want to be able to provide the best services, but we can't do that without a very talented and trained team. And so we'll continue to be recruiting for a long time to come.
Thank you. Valerie, I think Rose helped us tremendously lead into the second part of the questioning when she talked about a trained workforce and the needs that we have. Obviously, there are two strategies as we look at what I call transformative staffing models, and we start looking at new staffing models with, Valerie, exactly like you said earlier, telemedicine is changing the way we are conducting our business now in the healthcare market. And with that, we need to look at not only hiring different strategies or in different segments, but also what is our training and upscaling needs with our current workforces, and what resources are out there that we can tap into to provide for those. So I'm going to shift directions a little bit during this conversation and ask that those healthcare providers on the phone, we talk a little bit about training and upscaling, and what do you see as the current needs that you have right now in your businesses and in your industries for additional training and upscaling in present time?
Well, on the central health and community care side, we have begun our EPIC journey. So with that, we have been doing a lot of hiring for instructors, for developers, analysts, etc. And we anticipate that all that staff that we have hired will provide and will provide training to the staff at community care. And there's a lot of opportunities for staff to learn a new software, learn a new EMR, and that's only going to make them more competitive in the workforce.
Absolutely, thank you. I think as a lot of people that are in the healthcare space know, there's certainly a transformation to EMRs, and that will not change going forward. So you're seeing a lot of current workers and workers that are entering the healthcare space having to become better users of computers and electronic medical records.
Absolutely.
Very nice. Thank you for sharing. Anyone else on current training and upskilling needs that they may have out there?
Sure. This is Rose. I'll chime in on that. That's a really important discussion that we have in our industry. In particular, I find it to be related to leadership development. We find that many people who want to have a career within our communities, in our organizations, can slowly develop into different leadership roles. But that is one area that we have not fully developed platforms for. And so what we're talking about a lot with HR directors in a lot of large organizations is how to be able to have an ongoing career ladder training that develops individuals on leadership skills as they're currently employed, so that it's a benefit to them and they continue to build those skills over time. And then if an opportunity arises for them while they're employed, they can have better tools behind them to jump onto those roles. Many times we promote from within, and by doing that, it's not always a success if they aren't properly trained on how to become the leader versus the employee working. It's a shift for that. So that's a focus for us that we've been.
Rose, do we lose you?
No, I'm sorry, I stopped.
Oh, that's okay.
That was my pause moment, I apologize.
Gotcha, okay. No, thank you for sharing that. I think we tend to, at times, not focus on our leadership, particularly during times of pandemics, if we want to classify that. You know, there was a report that just came out that says 9 out of 10 workers say their managers have done a good job supporting them through the COVID-19 crisis. Yet very few of those leaders say that their companies have provided them enough training how to be effective during a crisis, particularly when it comes to managing remote employees. I think some of you shared that earlier on of how many of our employees now are working remote. So as a follow-up question, are there additional training and upskilling opportunities post-COVID for these managers, particularly on managing remote employees? Do you see that, and do you hear that from your managers in your healthcare space?
Mark, I want to backtrack a little bit because I very much wanted to follow up and continue the conversation Rose had begun. In Central Health, last year we were very excited to begin and initiate our new Emerging Leader Program. That was kicked off November 4th in 2019, and we called it the ELP. And it was provided to give frontline staff and supervisors an opportunity to receive education and the tools needed to go into a leadership role within the Central Health enterprise. The ELP committee comprised of staff throughout the enterprise. They developed guidelines and design for the curriculum, and they spent numerous hours developing the guideline content and finalizing everything that it enthralled. And we were able to begin a new class of emerging leaders, and it's going to be on an ongoing basis. Every year, a new class of emerging leaders will begin, so that there is a good pipeline that is developed within the enterprise to create our leaders. Now, the new challenge is how are we going to continue this in a COVID environment? We're probably going to have to change the curriculum, change how we get together, and give everyone what they need in order to succeed. Thanks.
Thank you for sharing. Sounds like a wonderful program that I think a lot of us on the phone would love to learn more about that ELP. And you're right, it's going to create, I think, opportunities from a training and upskilling need of how do you continue this program from a remote location and provide that training maybe outside of a normal classroom. And I think that'll be some of the challenges that we see from our education partners in the community also, as they are adjusting to teaching differently and teaching from a remote standpoint. How can we do the same thing in our industry of continuing these great programs that we have already on board? So thank you for sharing that. I appreciate it. Additionally, before we move on and I transition to Amber and have her talk about some of the employer services, I do want to put a plug out for the upscaling toolkit that has been developed, and it is a resource. I think Amber might talk a little bit more about it, but I do want to put a plug into it as an industry, as a business that has used that toolkit here at Baylor Scott & White. It is a tremendous resource, and if you have not had an opportunity to use it yet, I think it will be sent to you later today, and I encourage you to take a look at it. So with that, I'm going to turn the microphone over to Amber.
Great, thank you so much, Mark. And thank you for promoting our upskilling toolkit. I'm very happy about the results of it. So yes, we can certainly send that to you all so you can see it. And I think that the conversations have been great in discussing what opportunities are available for training and what the employers are looking for in those regards. So I wanted to provide you all with some information about workforce solution services. We know that COVID-19 has led to a lot of things, including layoffs, increase in hiring, depending on the field, and other challenges that have come from it. So I wanted to make sure that you guys were all aware of the services that Workforce Solutions can provide at no cost to employers as well as individuals. And then if you guys have any questions, you can reach out to me via email. And as my colleagues had mentioned earlier, I'm the Director of Upskilling and Advancement. So one of the big things that we've seen with COVID-19 is employers having to face layoffs, and we know that even in the healthcare industry, there's been flows of workers that haven't been quite as needed during this time. So that difficulty, we want to be able to provide the service of our rapid response programs. And basically what this does is it helps an employer with the layoff process in regards to helping their employees connect to the unemployment benefits with the Texas Workforce Commission, providing them the valuable information they might need with reconnecting to employment, or even with navigating new training or gaining additional skills so that they are more advantageous in the workforce. We always want to work with employers to see if any layoff aversion strategies can be done. So one option is the shared work program, and this is something that provides an opportunity to employers who might have to reduce hours of their staff between 10 and 40%. The Texas Workforce Commission will offer a partial unemployment benefit to supplement those hours that are lost. So we recognize that a lot of employers had to reduce the time that their staff was spending in COVID-19, and we know that that can be a financial burden for individuals. So being able to utilize the shared work plan allows them to maintain some of that income from the unemployment benefits. Additionally, with layoff aversion tactics, we want to offer training. So we do have funding available to help upskill your employees to ensure that they're remaining relevant in the adapting workforce. So as some positions wean out, we want to make sure that the other positions that are still being hired for and that are in demand, if we're able to train those employees to fill those positions, we want to help you in doing that. So providing funding opportunities to connect you with training providers and assist you in getting your employees to those positions that are in demand currently in this changing environment. Additionally, we also have layoff aversion funding that can help as the workforce is adapting with COVID-19. So some things that we see as strategies for layoff aversion is purchasing remote access equipment. We know that a lot of individuals have moved to working from home, so being able to have access to the work, either through technologies or other means, is something that we can look into assisting with funding. We also can help with offsetting costs of cleaning or sanitation services, or with the expenses that come from some of the guards that are required or the PPE required in order for an individual to maintain their work. So rather than laying off individuals, we want to be able to provide additional funding to offset the costs that are being incurred due to this pandemic. We've also thought of some strategies that include security costs. So I don't know in the healthcare industry if physical properties have been left, but some of our employers are facing the fear of vandalism or theft. So being able to increase security and can help them maintain their workforce and not have to worry about those additional costs caused by the pandemic. The layoff aversion funding can be used in other ways outside of these three that I've talked about, and it really is working with the employer to figure out what's the best way to maintain your workforce. So if that's something you guys are interested in looking at, I'd be happy to speak with you about it more. Additionally, if layoffs do have to occur, we want to make sure that employers know all of their options. So temporary layoffs are an option which allow employers to furlough their employees up to 12 weeks. So they can hire them back either before the 12 weeks is up, or if they don't hire them after those 12 weeks, they just move into a permanent layoff state. One benefit of this is that the work search requirement isn't required for them. Currently with COVID-19, that requirement for unemployment benefits has been waived, but we anticipate as the state begins to open up, it will be brought back. So if it's a temporary layoff, you can ensure that your employee is still returning to you or hopes to be returning back to you as the employer rather than looking for other work. So that can help you maintain your workforce. Additionally, the mass claims process is a great program to help both you and your employees. It streamlines the unemployment benefit claim process, so the employer is actually filing on behalf of the employees if an employer is laying off 10 people or more. And this takes off the burden of the employees having to file themselves, especially with the high volume that the Texas Workforce Commission is seeing. It has been a challenge for individuals to get their claim in, so the mass claim process can help with that. It also helps the employer because when you lay off an individual, you have to confirm. The Texas Workforce Commission will send you a notification confirming that that individual was laid off. So rather than doing that multiple times, you can just submit this mass claim once, and the Texas Workforce Commission won't have to reach out to do that confirmation. Workforce Solutions is also providing assistance to employees via webinars. So if you are facing layoffs and you are experiencing layoffs, we want to be able to provide information about the unemployment benefits system. Some individuals have never been on unemployment benefits, and it can be a confusing process if you're not reading all the rules and regulations accordingly. And the mistakes that some people are making can be really costly because the volume of people applying, it takes time to fix those issues. So to ensure that your staff are receiving their benefits as quickly as possible and doing the process correctly, we can host an information session with a Texas Workforce Commission representative to go over what that process looks like, and also some of the services that Workforce Solutions can provide support for them. We're also hosting additional webinars to highlight the changing workforce environment. So Leslie and her team have developed some great webinars that include resume building, how to work from home, soft skills webinars. So these can be valuable for both individuals who are still working for you or individuals who have lost their job. We're also hosting a Jobs Now page. So we are pulling job postings and speaking with employers who are hiring to work with them on connecting to the unemployment claimants. So we have direct access and we're reaching out to unemployment claimants, this huge pool of talent that's come to us, and we're trying to reconnect them to work. So being able to get your job posting onto our website can help you connect with those individuals that are searching for work. We can also assist with the workintexas.com website. This is a state website that is great for recruitment, and all of the unemployment claimants and individuals that have been impacted by COVID-19 are utilizing this site through the Texas Workforce Commission with the unemployment benefits. It provides labor market information, virtual recruiters, and our staff are available to support with both setting up your account and also helping you with posting job postings to the website to ensure that your information is up to date, and we're connecting you to the employers or the individuals, job seekers that have the skills you're looking for. We can also offer assistance with training and upskilling. As Mark mentioned, we have the upskilling toolkit, which we'll be sure to share with you, but we do have some funding opportunities to assist with the training and upskilling. So the COVID Training Initiative Skills Development Fund, this is to help employees with training for a skill that might be needed. So I know that leadership training was mentioned. So that's something that we could look into providing assistance with training. We're really trying to focus on industries that are providing COVID-19 relief. So the healthcare industry is a great one to focus into. And this offers up to $2,000 per trainee. And we can work with a training provider of your choice to connect you to this training. Additionally, we have also incumbent worker training. This is similar to the Skills Development Fund, but it's primarily for individuals that have been working for you. The Skills Development Fund can bring in new individuals or people that have been furloughed or laid off and bring them back and to receive additional training. With the incumbent worker training, it's just individuals that are working for you as the majority of the cohort, or even just a single individual that you're looking to have upskilled or trained. And this requires an employer match, but depending on the employer size, we can pay either 90 to 50% of the cost. So it really offsets the cost of the training incurred. The match can also be provided in kind. So if you're paying your employees while going to training, we can go ahead and count that as part of your match. And that's a great opportunity for individuals who might have a family or other instances where they need to maintain their income and can't attend training otherwise. We're also working with expanding apprenticeship programs into the healthcare industry more and more. So we do have a medical assistant program that we've started with Baylor, Scott & White and ACC, which we're really proud of. And we're looking to expand the apprenticeship programs more. And we're working to do a radiological technician apprenticeship program with Austin Community College that will upskill incumbent workers in the healthcare industry to meet some of those needs. So if you're interested in that program, that's something that we're pursuing a grant for now. So please reach out to me if you'd like to be an employer partner on that. We also have additional training opportunities that can include on-the-job training. This is for individuals before they're hired into your organization. So either we can help you connect to job seekers that are looking to work within your positions, or individuals who are speaking with you but haven't been hired yet. And we can provide a reimbursement of 50% of the wages, not including holidays or overtime, for either up to 6 months or up to $10,000. So this really allows new employees to be trained in your own company culture. And we provide the assistance of recruiting those individuals and also connecting you with those wages. And it builds a community of skilled workers. We also offer subsidized employment, which is similar to the on-the-job training, but they work under as our employee, but they work at your location. So they're still training with you and gaining the skills that you need. And then you're able to have the opportunity to hire them upon completion, and this is up to 12 weeks of training that we cover their wages. Lastly, we're here to help. We know that COVID-19 has come with a lot of challenges, but it's also come with a lot of opportunities. So we definitely want to work with you to see what we can do to assist you and better position you all in the workforce environment and help you connect to those job seekers that have recently been affected. So I love that one of the things that Valerie had mentioned in the hospitality industry, so many individuals have been impacted and they might not have thought to go to assisted living or other healthcare providers. And that can be a direct opportunity to help them with career advancement and growth. So any opportunities like that or anything that I had mentioned from the other programs, we're here to assist. Please feel free to reach out to us and we're here to help. And with that, I'll turn it back over to Mark and Valerie.
Thank you, Amber. A lot of valuable resources. I was continually taking notes throughout your whole presentation of all the exciting work and resources that are available to us and to our workers. With that, I do want to start out and thank everybody for their participation today. Through this COVID-19 pandemic, I think we as in healthcare have proven that we can rise above any challenge. We can adapt to any circumstances and situations, and certainly in times of uncertainty and fear, a lot of them from our workers and our frontline staff, that we continue to lead with compassion for all those around us. So thank you again for joining us. Thank you again for continuing to care for our community and our community members. Everyone today on the call will receive an email with a link to the recording of this webinar, as well as links to all of the Workforce Solutions Capital Area Business Services that can support you moving forward. With that, I'd like to turn it over to Valerie to close.
Yeah, thank you, Mark. And I too would like to thank everybody for participating on this call and for allowing us, for sharing your information and allowing us to present to you. I would definitely encourage everyone to follow Workforce Solutions Capital Area on social media, just to stay informed on the many valuable services they can provide and opportunities for you to engage with your current and future workforce. And with that, I hope that everybody has a good day, and thanks again. Take care. Stay well.
Thank you. Thank you, everybody.
Thank you
too.
so
Thank
much,
you, Valerie.
everyone.